All right, Tim, we're back. Okay, having talked about what diabetes is, um, what are the signs of diabetes and the type of diabetes, now let's look at the incidence of diabetes. How common is diabetes? Chances are, if you don't have it yourself, you probably know someone who does. But what is the paper saying? For instance, in the United States, they have said over 96 million of their population actually are pre-diabetes, which means these are people that are walking about with sugar that is higher than the normal threshold, but not fully diabetes yet, but they are on the verge of becoming someone who will need medication, right? In the United Kingdom, the story is not different. UK says 1 out of every 5 adults now in the UK is going about being pre-diabetes, meaning they are already insulin sensitive. They are going to eventually become type 2 diabetic unless they do something about it. 1 out of every 5. Look around you. How many people are in your household? This will give you an idea of how common it is. Now, out of this 96 million, about a million of these people are those with type 1 diabetes. They have type 1 diabetes, those ones we say that they don't have control over this, is genetically induced. But the majority of the population are actually those with type 2 diabetes. It's so common and so rampant these days because of the choices you and I have made, right? 1 out of every 4 adults in a lot of places. For instance, in Nigeria, it's almost 1 out of every 2 because the papers are saying 46% of an average adult in Nigeria has a form of sugar sensitivity that they are not aware of until symptoms or until they become sick and they go in the hospital. So, which largely means we are brewing a population, a sick population that many people don't even know. And considering how deadly this ailment can be, that should be something that will worry you and I. Especially, this is now something that is now affecting even more younger population. Look around you. How many people do you know that are obese? The thing though is, most people do not actually understand how big they are that can then predispose them to type 2 diabetes. 1 out of every 4 adults, walking about with this condition. It's so large. And this is putting a strain on the medical budget. This is one of the reasons why now it's becoming even more and more difficult to access care in so many places, because larger than, required number of people are now requiring medications or support for something that can be largely preventable if people know what to do. If we have enough discipline, desire, and determination to do something about it. I want us to think about that. Diabetes can be within our control. Sadly, though, the projections is that this is year 2024. We're saying 1 out of every 5 adults now. The projection is actually that by the year 2050, it will be a case of 3 out of every 5 people if we don't do something about it today. Before I stop this video, because we are talking about how much of this we have around, I want us to actually think more about things we can do to prevent ourselves from becoming one of these statistics if you are not already there. And if you're there, what can you do to bring yourself out of these numbers? Because diabetes, type 2 diabetes, lifestyle related diabetes, diet induced diabetes, nutrition induced diabetes, it's something that can be reversed. Hear me right, I said it. It can be reversed. I use the word reverse for a reason. Because when you reverse something, It means you go back to where you were before. That is before you had it. But once you've reversed it and you don't do something about it, or you don't sustain the reverse, it can still come back to haunt you. So this is why I am very big on preventative approach. Once we've prevented, we stop you from getting it, or once you have it and we actually reverse it for you, we want you to go back to the state where you can always stop yourself from getting back to the sick state again. Do you understand where I'm going with this? I think you should do. And if you don't, I will lead you there. Let's take a break.